I've worked at Lionsgate on the inpatient unit and down in emergent psychiatry for over 10 years. We have a great staff team, and I think the team is quite committed to providing the best quality, patient-focused care. However, there's definitely some limitations with the building, one of them being it's an older building and it was never designed to be an inpatient psychiatric unit.
In working on the inpatient unit, I think that the strengths of the inpatient unit are the staff that work there. There's a great complement of nursing staff, social workers, occupational therapists, clinical pharmacologists, and physicians. So I think that's really an asset to the community, as well as the partnership with the community players as well. I think the difficulty or the challenges of working at Lionsgate is the building itself that we're housed in. It's the original 1928 or 1929 hospital, and it is definitely deficient and makes clinical care difficult to deliver in the 21st century.
I was suffering from major depression with psychotic episodes. My family didn't know anybody who had had a mental illness, or at least anyone who was open about it. So it really opened my eyes, and it really opened my friends and my family's eyes who came to visit me. Mental illness can affect anybody of any, class level or any age.
Well, something that most people aren't aware of, that we only have one single room on the unit, and then we have a few other shared double rooms. Otherwise, we have dorm-style rooms, and so a new patient coming on the unit may have to be in a room with 4 other patients. Having to share a room is definitely a huge hindrance for someone's recovery, because if someone's louder in the evening, or if they make a lot of noise when they're sleeping, if they're snoring, or if the temperature isn't how they would like it, they're having to accommodate other people in the room. And definitely, I think, as administrator, that it increases their length of stay.
Friends of mine that have had stays here, they've always mentioned that the staff has been great. It's the facility. The seclusion room has a purpose, but I think it doesn't have to be like a prison. Especially if people are having extended stays in there, 5, 7 days, 12 days. I had a friend that was in there for 12 days. Because it takes that long sometimes to get people settled down.
Our son Matt was diagnosed bipolar, and his first onset was about 6 years ago when he was 19. And the facility itself is very run down, it's quite shabby, very depressing. I think a situation like that would be depressing anyways, but this is particularly depressing to have him in there. There was no private places to kind of sit and when you'd visit to have talks or anything with him or see what was going on.
The facility was dated. It is dated. It's, for better term, it reminds me of One Flew Over the Cuckoo's Nest. It's the same sort of time frame that the building was erected, so it was a little bit shabby. But the staff and the support staff and the psychiatrists were just over the top fantastic.
The layout is, in my opinion, quite unsafe. We utilize cameras and personal alarms to keep the staff safe. However, the amount of time spent walking around the unit and doing close observations on the patients to maintain their safety definitely uses a lot of time for the staff.
For a variety of reasons, a campaign for mental health and addictions is vital to the North Shore. Our facility is very aged, and we do need to replace the facility. Building the Mental Health and Addiction Center sends a very important message to the community that we recognize the importance of mental health in the spectrum of healthcare. With a new center and a combination with UBC Academic will really position the North Shore to provide world-class facilities and world-class healthcare delivery in order to address the mental health and addiction issues that are so relevant. We felt that that was an appropriate leadership that the foundation should be taking on as its responsibility.
Having a new facility is paramount to the mental health on the North Shore.
And make the delivery of care that much more timely and that much more beneficial to the patient at large.
One of the main reasons is that when something like this first happens to a family, it's a family, I call it a family disease, because it doesn't just happen to your loved one, everybody's impacted. And when that's happening, I think having everything in one center, someplace what everybody knows about, you can go, get the services you need, find out what's available, get advice, having it all in one location would be amazing.